Hello and welcome to Orion Outreach. I'm Joe Johnson, and today we have a panel of experts here with me today to talk about a countywide program called ECHO. I'm going to direct my first question to Kathy Forsley. Kathy, what can you tell us about ECHO?
Well, ECHO is an Oakland County Health Division initiative. It's a collaboration of partners, and the whole reason why we brought it together, the panel of partners together, is to improve the health of Oakland County.
What are specific issues that need to be addressed in your opinion as far as the health of Oakland County?
Well, that remains to be determined in this process, because ECHO is all about the process. Really, there are 3 phases to ECHO: identify, prioritize, and act. And during the identification segment of ECHO, we will be doing 4 separate health assessments. All of our partners will join 4 different teams, and they will do quantitative and qualitative assessments to get a really good picture of the health status of Oakland County. And from there, we go on to a prioritization phase where the partners will rank and prioritize what they believe to be the most pressing public health issues that we have in Oakland County. And then finally go on to an acting phase where we will develop together collaboratively a comprehensive health improvement plan that will be sort of a guidepost for all of our partners in the community to do some internal strategizing as to how we might better align our programs and services to meet the mutual goals to improve health in the county.
You referred to your partners. Can you give us an idea of who's going to be making this program possible?
We have invited a plethora of partners to the table. We currently have a steering committee, which these 2 ladies are co-chairs for, that is overseeing the whole process of ECHO. And there are currently 30 partners on that steering committee that represent more than 10 health sectors, or sectors in the community, I should say. And then the assessment teams, we will draw in even more people into the process, more partners.
Now, you told me about an official kickoff. Do you want to give us some information about the official kickoff?
Yes, on April 28th, we will be having a kickoff at the Executive Office Building and the county offices. And at that time, we are inviting the community, especially more community partners that want to know more about the ECHO process, hear an overview of it. Also, they can meet the co-chairs. They can decide if they would like to participate on one of the assessment teams, or even if they just want to have more information about how to stay engaged with ECHO, get information about what we're finding out about the health of our community, they'll find out at that time. We'll also be rolling out a data dashboard that will be of great benefit to people in the community in terms of being able to go online and see information relating to the health of Oakland County.
Okay, so let's talk about this. You talked about assessing the issues that are out there. Do you have a plan in place as to how you're going to gather the information? Is there going to be a community survey? Are people going to be expected to visit a website? Talk about that aspect.
Well, that is one of the pieces that the individual assessment teams will be deciding as they meet. They will be looking, as I said, at quantitative and qualitative data from the community and information they'll gather. They're going to make decisions together how they intend to pull this information together. Will it be community forums, surveys, various methods for gathering the information?
So that's yet to be determined.
Yes,
then.
correct.
Okay, how did this program become possible? How was it born?
Well, public health has always been charged through the Public Health Code to do community-wide health assessments routinely. So every few years, this is something that we've done. However, and now hospitals are charged with doing community health assessments, and really every program and agency is doing some type of assessment to determine how to best serve the needs of their clients or patients that they're serving. But the problem with that is that we're all doing our own form of an assessment based on what our knowledge is going in. When we pull all of these partners together, we have a much expanded knowledge base to work from, different perspectives that will tell us what's important information to gather and maybe what is less important to bring to the table. So this comprehensive approach involving community partners is going to give us a much more comprehensive picture of the health.
And then once the program kicks off, do you envision it being ongoing?
Yes.
Or? Okay.
Yes, reoccurring process.
So once the data is gathered from whatever input mechanisms you decide to put in place, what is going to be done with the data? How are you going to use that information?
Well, that's very important to understand that the data itself is going to drive the process and the outcomes. And so it's not us saying that going in, this is what's going to happen. The data is going to determine that. And this is really the first time that we've ever done this in Oakland County, to be able to really research and find out how to use our scarce resources the most efficient way.
Mm-hmm. Do you have an idea of what the results may be? Has there been any research or information to date that might give you an idea of what some of the major concerns are going to be?
Well, we all know what our own concerns are within our own departments, our own organizations, but when we come together as a collective, now we're going to see, well, what is really important for all of us to focus on. Instead of our individual needs or individual desires, it's going to be what's good for the county and the health of our people.
Okay. I envision one of the benefits that'll come from this will affect insurance, and because a lot of us we tend to react after something happens, and it sounds like this program is geared toward preventative maintenance, which will affect medical costs and insurance in the long run. Do you agree with that?
Yeah, I think that's actually going to be a byproduct of this. I don't know that that would be the direct aim of the public health effort, but I would say that for us community providers, it's certainly a key reason why we're at the table. It's kind of the sweet spot in terms of the Affordable Care Act for so many sectors that are involved in healthcare. We're all focused on this right now. So as you said, it's been a sick-based society. So you go to care, your care follows your sickness. We're trying to move to a wellness society, and that's what the Affordable Care Act really supports, is preventative care, well care. It's a huge cultural shift. Our agency is looking at that, just as the community is. So what this ECHO effort does is really puts the focus back on wellness. As soon as you start focusing on wellness, you shift the cost curve. It's a large process, a huge systems change. But that's what's so exciting about so many of these different sectors: hospitals, emergency medicine, individual doctors, behavioral health, so mental health and substance abuse, private nonprofits, community mental health. We have the Department of Education, Oakland Schools, all involved in focusing on this. If you can mobilize an entire community to look at wellness, costs will follow.
So what people who become involved with the program, what will be expected of them once the needs are assessed? Is the program going to focus on encouraging people to get screenings and tested? Are we talking about recommendations for diet and exercise? Or is it going to incorporate all of those things?
The data is really going to drive what comes out of it. I know we keep saying that, so it sounds vague, but we're trying not to lead the process. But yes, those are the kinds of things we could expect. Anything from we need more parks to we should have access to screenings in different ways to, we don't want to say, commit ourselves to something that we don't know what's going to happen yet, but it's really, that's the advantage of doing a community-wide effort, is if you want to have a voice, get involved. Because we'll be pulling data from every aspect, and there'll be lots of opportunities for people to say, this is where I see our health now and access and status, and this is where I'd like to move it to, and this is how we should do it. This is an opportunity to have a voice in what Oakland County's health will look like.
Okay. Once the program is kicked off and objectives are established, where can someone go to find out more information and to find out how they can get involved?
Well, go to our website at www.ogov.com/health. And there's a button on that screen for ECHO, and push that button and you'll get more information. You can sign up if you want to receive more information. You can even sign up there to be on one of our assessment teams.
Terrific. Is there any other contact information you want to give out, or can that all be found on the website?
They can all be found there.
All right. So what else is in the future? What else does the future hold for ECHO? You said this is a long-term thing, not just a short-term thing. So what can we expect from ECHO in the future?
Well, this, as I said, it really is going to be launching our assessment process. And that, we think, will go on till probably February, March of 2015. And then at that point, we'll be looking at all the data. We'll be actually doing some reporting out to the community. We want to get this information out to everyone, what the findings are. And then from there, going on to build our comprehensive health improvement plan. And then we don't stop there either. We'll be launching some action teams at that time to make sure that the health improvement plan is actually implemented, and then sort of starting the process all over again. So it'll be a continuous cycle.
Okay. Now, hopefully this doesn't catch you off guard, but I'm going to ask you this question. Are there any stats and figures you can throw out right now about the health of Oakland County and Michigan? Are we perceived as being generally healthy or unhealthy? Any thoughts you have on that?
You know, there are a lot of reports and rankings that come out, but every one of them paints just a piece of the picture. And that's what we're trying to get away from here, as we really want a comprehensive view. We do stack up very well. We have an extremely good quality of life in Oakland County, and we're very privileged to be living in a county that has so many great resources. But in terms of a comprehensive picture, right now there's a lot of separate reports and separate evaluations that have been done, and that's not the whole picture.
Did I hear someone mention earlier that mental well-being is going to be part of this objective too?
Absolutely.
Yeah, it's all about integrated health at this point. So we've lived in a world where behavioral health, meaning mental health and substance abuse, have been siloed separately from physical health. Again, the direction of Affordable Care Act and healthcare reform has really seen the importance of what we call integrated health. So what we know is that folks who have mental health issues, so who are diagnosed with long-term chronic depression, their chronic health conditions are much worse as well. In fact, they have a longevity that's much less than a person who does not have depression, their actual lifespan. And so by integrating health and having primary care doctors know what to look for and how to treat somebody, and when somebody enters into treatment for alcoholism, we can't avoid the health issues that go along with that. Right. So absolutely looking at from a holistic and integrated approach.
All right, that's so important. That's great. Before we leave, let's just remind our viewers one more time about the kickoff event, and that's open to the public to come in and attend?
Yes, absolutely. Anyone that has interest, April 28th at the Oakland County Executive Office Building in the Conference Center at 9 a.m.
Terrific. All right, looking forward to it. Well, thank you for joining me here today on Orion Outreach. I really appreciate you stopping by our studio.
Thank you.
Thank you.
And thank you for watching. We'll see you next time on Orion Outreach. I'm Joe Johnson.